I'm Dr. Harry Gasper. I'm a medical oncologist and I'm the Director of Medical Oncology at Toowoomba Hospital. We have an amazing team of doctors, nurses, allied health staff, pharmacy staff and admin, all dedicated to people with cancer. And we want to continue to grow that here at Toowoomba Hospital to service Darling Downs and beyond. Cancer is set to become the second biggest killer, unfortunately, and we are seeing 15% year-on-year growth in the number of patients who come for our service. This is a disease that needs treatment now, but we need to be planning for the future. Toowoomba needs a cancer centre. We need a dedicated place where people can come and see specialists, not just doctors. We're talking about specialist nurses, specialist allied health. We need a gym where people can actually rehabilitate from their treatment. We need dedicated laboratories that are specific for cancer care and being able to use the amazing improvements in technology to provide treatment to patients further afield.
The nurses here are amazing, lovely, kind, make you feel like family. With what they're working with, they're amazing. Like, they just squash everybody in, and more room would probably be great for them because they have a lot of people every day, and they can only fit so many in.
So some of the limitations that we come up against, so we have an aseptic compounding suite on site, but currently that's located in a separate building, and making that trek sometimes 8 or 9 times a day really kind of impacts our level of care for these patients.
Probably the hardest part for us as allied health though is that we have no clinical space. We have one room, so I end up having conversations with patients in corridors and at chemo chairs. So if we can have a centre that's unified, standalone, allows all staff to work together, then just the feeling and experience for patients, even that's going to be healing.
The unit is just growing. I think our numbers are doubling every 5 years, and we've been in the same building now for probably 10 to 15 years with nowhere to move. We're turning storerooms into offices now because we just need space.
So my role here is to deliver cancer care therapies over video connection to our rural and remote communities. We've had such a huge growth in numbers, over 91% growth in the last 12 months, which just goes to show how important this service is for our rural and remote communities, to the point now where we're having to convert some of our storerooms into offices so that we can continue to safely deliver our cancer care treatments.
We have a lot more patients as more people are getting diagnosed with cancer, and with the modern technology developing, a lot of people are living longer with cancer, so our patient cohort has expanded exponentially.
When a patient comes to a cancer care centre, in my view, it's from the moment that they find somewhere to park, that has to be closed. Patients who are unwell physically and even psychologically quite stressed, they have to park on the other end of the hospital and then walk or catch a buggy to this side. That's already not a good experience even before they meet us, so that's very important.
A new and improved treatment centre would mean that we can offer more specialised and newer treatments that currently we're diverting down to our bigger sites in Brisbane.
From a haematology perspective, if we had access to newer technology and more staff as well, there is a lot of scientific advances, specifically in haematology with stem cell transplant, CAR T, hopefully in the not so distant future with a new centre we would be able to facilitate that treatment here.
Having a place where they can almost feel like is their second home to help them get through the difficulties of being diagnosed with cancer, I think will make a big difference to their outlook and to their outcomes as well.
Even though they try really hard to get you on the same day, it doesn't always happen. So you may drive 200 k's and then have to come back the next day for a 10-minute appointment or something like that. So if it was all in the one building, it would be a lot easier.
Providing care for patients with cancers is complex. It requires the input of lots of different people, and we're seeing that grow and grow. So we need a dedicated cancer centre to be able to provide all of those interventions in one place, in a place which is comfortable, in a place where patients can come and not feel like patients, feel more like people. Ultimately, we want the regional cancer centre to become a centre of excellence and somewhere where other people look as an example to provide healthcare to patients with cancer in a regional setting. We need a cancer centre which is staffed by people who live in the region, who understand the region, and is for the region.